mock. Okay. So welcome everyone at today's mock session, anatomy, head and neck. So this head and neck portion is very important in exam because frequently there will be a question from neck portion or from brain neuroanatomy come in exam. So this head and neck part of anatomy is very important for your examination. So we will start with our head and neck portion today. So who want to participate the mock, please raise your hand first so that I can select you. Okay. Okay, so I can see Dr. Bari Bhai, Dr. Jahida Akhtar Apu. Okay, so let's start with Dr. Bari Bhai. The first image. Okay, so can you see the screen and timer properly?
Yes.
Okay. So I'm now going to start the timer for you.
Okay.
So this is your image.
Mhm.
Okay. So in this image, what is number 31?
Is number 31 is sternohyoid muscle.
Okay. What is 32?
Sternothyroid.
Sternothyroid. What is 38?
Is 38 thyrohyoid muscle.
Okay. And what is 34?
34 is supraomohyoid
Okay. So
muscle.
what are they collectively called?
Collectively called is it's called infrahyoid muscle.
Excellent. So these four are infrahyoid muscle. Can you tell me which two are deep muscle and which two are superficial muscle among them?
Okay, so actually sternothyroid and omohyoid is superficial.
Yes. And rest two are deep. And you
Deep.
can also tell that the superficial muscle, omohyoid and sternohyoid, these two are also long muscles of
Yes.
infrahyoid muscle. Okay. Now tell me what is number 15?
15 is hyoid bone.
Okay. What is number 24 here?
24 here is cricothyroid membrane.
You can try again.
Cricoid cartilage
Not cricoid cartilage.
or membrane. Cricoid.
Which structure situated here? A
Okay.
gland.
A gland, right?
So
Uh,
which gland?
Thyroid.
So this will be the thyroid cartilage. Okay. And
Okay.
cricoid and hyoid situated here in the upper part of the neck. Okay.
Yes.
So here
Okay.
it will be oblique line of thyroid cartilage.
Thyroid
Okay.
cartilage.
Now tell me the nerve supplies of the infrahyoid muscles.
Okay. All the muscle is supplied by the ansa cervicalis, except and thyrohyoid, which is only supplied by cervical C1 root.
Okay. Now tell me the actions of the infrahyoid muscle.
They will help. They will help during by the contraction of the infrahyoid muscles causes a downward descent of the hyoid bone. By this way, it causes opening of the mouth and help in the swallow and yes, help in the swallow.
Okay. It helps in swallow, but this infrahyoid muscle basically just downward causes downward movement of the hyoid bone. Okay, and
Mhm.
mouth opening, the muscles involved in opening of the mouth is different type of muscle. Okay.
Okay, okay. So
So now tell me, what is number 41 here?
41 here is trapezius.
Okay, and what is 30?
That is the sternocleidomastoid muscle.
Okay, now tell me the boundary of posterior triangle of neck.
Okay, so anteriorly the posterior border of the sternocleidomastoid, posteriorly the anterior border of the trapezius, and inferiorly medial 1/3 of the clavicle, and superiorly and superiorly is mastoid process, the temporal bone.
Is it mastoid process or the lower border of the mandible?
Yes, sorry, the inferior lower border or inferior border of the mandible.
Okay. So now tell me, basically you can also say the meeting point of the sternocleidomastoid muscle and trapezius muscle. Okay, this will be easier for you. Okay, now tell me what are the contents of posterior triangle of the neck?
Okay, and in posterior triangle, there is a content of the spinal accessory muscle, and as well as the branches of the cervical plexus.
Spinal accessory muscle or nerve?
So nerve, spinal accessory nerve,
Okay,
and branches of the cervical plexus,
okay,
as well as subclavian artery and the root of the brachial plexus.
okay. Any vein? Any
And
important vein?
yes, internal jugular vein
Are you sure internal
or
jugular vein?
external jugular vein, as well as step muscle. One is scalenus anterior medius muscle.
Okay. So, and also there will be some lymph nodes.
Lymph node, yes, supraclavicular and occipital lymph node.
Occipital lymph nodes. Okay. Now tell me the boundaries of the anterior triangle of neck.
Anterior triangle neck is midline of the neck, and on the lateral side is in above. It is the anterior belly of the digestic.
Are you sure anterior border of the digastric?
Okay, I'm really sorry. So the midline of the neck is anteriorly, and the inferior angle of the mandible, as well as the anterior border of the sternocleidomastoid, and meeting. Yes, sternocleidomastoid.
Okay. So what are the subtriangles of anterior triangle, you know?
Okay, there is a submental, submandibular triangle, as well as carotid triangle and muscular triangle as well.
Okay. So can you tell me the content of carotid triangle?
Yes, carotid triangle contain carotid sheet, which contains and common carotid artery, as well as the internal carotid artery, and and internal jugular vein, as well as vagus nerve, and in anteriorly to the anteriorly of to sympathetic anteriorly of the carotid sheet, ansa cervicalis, and posterior to the carotid sheet, sympathetic chain.
Okay, excellent. So here you can see number 17, which is
It's internal jugular vein.
internal jugular vein. And what is number 7?
And number seven is yes, it is yes, it's a common carotid artery.
Common carotid artery. Excellent. And it will be divided into internal or external at the level of upper border of thyroid cartilage here. Okay. And now number 1 is ansa cervicalis. So
It's a
this
cervix.
is the carotid triangle, and these are the contents of the carotid sheath.
Yes.
Okay. So now tell me the content of submandibular triangle.
Submandibular triangle content is submandibular gland, as well
Okay.
as submandibular lymph node, and lingual nerve, hypoglossal nerve, marginal mandibular nerve. And
Okay. And the most important thing is the facial vessels. Okay. Here.
Okay.
Okay. So now tell me the nerve supply of digastric muscle.
Digestive muscle, anterior belly of the digestive muscle is supplied by the mylohyoid muscle nerve, and the posterior belly of the digestive is supplied by the facial nerve.
Okay. Excellent. Dr. Bari, you have completed within your time.
I have to revise. It's supposed to be revised for more
Yes,
than
because the boundary of, anterior and posterior
yes.
triangle is very important, and don't forget this boundary. Okay.
Right. There is no option to forget this.
Yes, there is no option to forget this because sternocleidomastoid muscle is constant. Posterior border form
Right.
the anterior boundary of the posterior triangle, and the anterior border is forming the posterior boundary of the anterior triangle. So this
You're
is
right.
easy. Okay, no
Yes. Yes.
problem. No problem. So next is Dr. Jahida Akhtar. Okay, hello, Dr. Jahida Akhtar.
Hello, ma'am.
So how are you?
I'm fine.
Okay, so can you see the image and timer properly?
Yes, ma'am.
Okay, so this will be your station, and recently this type of station came in exams in this month. So let's see. Okay, I'm going to start the timer for you. So can you tell me what is number 42?
Number 42, let's say a thyroid gland.
Yes, so it is the lateral lobe of thyroid gland.
Thyroid gland.
Okay, so can you tell me the artery supply of this thyroid gland?
So a thyroid gland is supplied by the superior thyroid artery, which comes from the external carotid artery, and it's supplied by the inferior thyroid artery, that's the branch from the thyroid cervical trunk. And sometimes it's also supplied by the arterial thyroid aorta that comes from the brachiocephalic trunk. And in case of the venous drainage, there is the superior thyroid vein, middle thyroid vein, inferior thyroid vein. Superior and middle thyroid vein drains into the internal jugular vein. Inferior thyroid vein drains into the brachiocephalic vein.
Excellent. So now tell me the lymphatic supply of thyroid gland.
So the lymphatic supply of the thyroid gland goes into the prelaryngeal, pretracheal lymph nodes, pratracheal lymph nodes, and then it also goes into the upper and middle deep cervical lymph nodes, and also into the brachiocephalic lymph nodes.
Okay. So now tell me the embryology of thyroid gland.
So thyroid gland, basically it derives from the thyroglossal duct, which comes from the foramen of cecum in the posterior tooth, anterior tooth and posterior 1/3 junction of the tongue, and then it descends downwards, and then at the level of the thyroid cartilage, that is the C4 level, it forms the thyroid gland. And if there is incomplete descent, then it will result in the lingual thyroid. And in the duct pulses, then it will result in the thyroglossal cyst.
Okay. So what is the vertebral level of thyroid cartilage?
As the cervical vertebrum.
Cervical vertebra. Okay. So why thyroid gland moves up with deglutition?
So thyroid gland is enclosed by the pretracheal fascia, which gets attached to the hyoid bone and the thyroid cartilage. So when we deglute, the thyroid bone is pulled upward by the suprahyoid muscles. As a result, so the thyroid gland also moves up, as because the pretracheal fascia is attached to it.
Okay. So what are the nerves commonly injured during thyroidectomy?
The nerves commonly injured are the recurrent laryngeal nerve, external laryngeal nerve.
Okay. So when the external laryngeal nerve will be injured?
It will injure when we will ligate the superior thyroid artery.
Okay. And when the recurrent laryngeal nerve will be injured?
During ligation of the inferior thyroid artery.
Okay. So any other injury may occur?
There may be injury to the I cannot remember, sorry.
Okay, no problem. You can come back to it later. So now tell me the types of thyroid cancer spread via lymphatic routes.
Lymphatic nodes are parathyroid carcinoma.
Okay, are you sure parathyroid carcinoma?
Sorry, parafollicular.
Okay, lymphatic
Papillary
route.
is it's a papillary carcinoma of thyroid. Sorry.
Okay, no problem. So papillary thyroid will be through lymphatic route. And now tell
Yes.
me which type of thyroid cancer spreads via hematogenous route?
It's the follicular carcinoma of the thyroid.
Okay, excellent. Now tell me the cell of origin of medullary carcinoma.
Medullary carcinoma originates from the parafollicular cells.
Okay. So now tell me, what are the late complications of thyroidectomy?
So late complications consist, there may be hypothyroidism, and then there may be hypocalcemia.
Hypothyroidism and hypocalcemia.
Hypocalcemia.
Okay. So how many pairs of parathyroid gland present in human body?
There are two pairs of the parathyroid gland.
Okay. So can you tell me the location?
So there are two superior and two inferior, which are located behind the thyroid gland and each pole, in the superior pole and in the lower pole.
Okay. So what hormone is secreted by this parathyroid gland?
Parathyroid gland secretes the parathyroid hormone.
Okay. So significance of this parathyroid hormone?
So this parathyroid hormone is needed for calcium metabolism. In the kidney, it increases the renal absorption of the calcium and also decrease the renal reabsorption of the phosphate. And in the case of the bone, it causes bone resorption, increasing the serum calcium level. And it also activates the vitamin D3 in the kidney that causes absorption of the calcium and phosphate from the GI tract.
Okay. So now tell me the embryology of parathyroid gland.
The superior parathyroid gland originates from the fourth pharyngeal pouch, while the inferior parathyroid gland arises from the third pharyngeal pouch along with the thymus.
Excellent. So what is the blood supply of parathyroid gland?
Parathyroid gland is supplied by the inferior thyroid artery, and then it finishes the inferior thyroid vein.
So do you want to come back to this question? What else structure is
there,
included during thyroidectomy?
there may be a cervical sympathetic chain.
Excellent. When it got injured?
When we will ligate the inferior thyroid artery.
Yes. So when we put a lateral ligature on the inferior thyroid artery. Okay, excellent, Dr. Jahida. Okay, nice performance. When is your exam?
Now it's on September 12th.
Oh, that's great. Your preparation is excellent. Best of luck.
Thank you, ma'am. Thank you, ma'am.
Okay. So let's see who will be the next. Okay, Dr. Umme Atia, how are you?
Hello, ma'am. I'm fine. How are you?
Yes, I'm fine too. Alhamdulillah. So can you see the screen properly?
Yes.
Okay. So let's start. This will be your station. Okay. Let me start the timer for you. What is number 1 here?
Number 1 is anteroclinoid process.
Okay. Now tell me what is number 4?
This is cleavus.
Okay. Can you tell me a name of a nerve which tracks down here?
Here, abducens nerve.
Excellent, abducens nerve. What is number 8?
This is dorsum sella.
Dorsum sella. What is number here? Okay. What is number 38?
Here is sella turcica.
Okay. And what is number 44?
This is number 44.
Yes.
This is the petrous part of temporal bone.
Yes. And here is the impression of a nerve present.
Internal carotid.
Okay.
I can come back to this.
Yes, sure. So now tell me what is number 13? Here.
13.
Yes.
This is superior orbital fissure.
Okay. Try again. What is number 13?
Here is also foramen rotundum.
Foramen rotundum. Okay. So now tell me what is number 12?
Number 12. Foramen oval.
And what is number 14?
Number 40. Foramen spinosum.
Foramen spinosum. What is 43?
This is the squamous part of the temporal bone.
43. That is the 41.
Okay, and 43 is the suture. Ma'am.
Okay, tell me what is the superior boundary of middle ear? Which thin bone is situated here?
Sorry, I cannot get the question.
Okay, so what is the superior boundary of middle ear cavity? Here is a thin bone present, which
Tegment
form the
tympani.
yes. So 43 is tegment tympani. It's a thin part of this bone which may get easily ruptured during any injury to the base of the skull, and that is why the CSF leaks through the ear. This is called
Okay.
otorrhea.
Yes, ma'am.
CSF otorrhea. Okay. Now tell me what is number 11?
This is foramen magnum.
Yes, this is foramen magnum. And what is 23?
And here is the impression for transverse sinus.
Okay. Now tell me what is 27?
Here is the hypoglossal canal.
Yes. And tell me what is number 30?
And this is jugular foramen.
Jugular foramen. What is 29?
This is internal occipital protuberance.
Okay.
Here.
Okay. That's all. And what is number 21?
This is the petrous part of temporal bone.
Okay. Excellent. This is the petrous part of the temporal bone. And what is number 28?
Here is number 28.
Yes.
I pass, madam, I want to pass this
Okay,
now.
no problem. This is internal acoustic meatus. Okay. As this is the petrous part of the temporal bone.
Yes, yes,
So
there is petrous part.
yes, along with this petrous part of the temporal bone, here the internal acoustic meatus. Okay, opening for the internal acoustic meatus. Do you come back to this 44 structure, number 44?
Ma'am, it's impression for nerve, you said.
Yes.
Trigeminal nerve.
Excellent. This is the impression for trigeminal nerve. Okay. So now tell me, from which juvenile structure the clavus is formed?
Juvenile structure. It's formed by spheno-occipital synchondrosis.
Okay. So what is the type of the growth plate in this clavus?
Hyaline cartilage.
Hyaline cartilage. Okay. Now tell me about the time of fusion of this clavus.
Time of fusion, it initiate in case of male 14 to 15 years and in case of female 12 to 13 years and completed at the age of 17 to 18 years.
Excellent. Now tell me some name of benign tumors in the posterior cranial fossa.
Posterocranial fossa, benign tumor. There may be medulloblastoma or glioma.
Okay. And also acoustic neuroma,
Acoustic.
ependymoma. Okay. So now tell me about cavernous sinus. From where the cavernous sinus drain blood from?
It receive blood from the superior ophthalmic vein, facial vein, and pterygoid plexus of vein, and also from the sphenoparietal sinus.
Excellent. Now tell me from cavernous sinus where the blood drains into?
It drain blood into superior inferior petrosal sinus and intercavernous sinus.
Okay. And ultimately?
And ultimately to sigmoid sinus and internal jugular vein.
Internal jugular vein. Okay, excellent. So now tell me the content of cavernous sinus.
Contents of cavernous sinus is lateral wall from top to bottom, oculomotor nerve,
Okay.
trochlear nerve, and also the oculomotor, trochlear, and ophthalmic nerve and maxillary nerve of trigeminal nerve.
Yes.
And from medial to lateral, the content is internal carotid artery, sympathetic plexus, and abducens nerve.
Excellent. So what is the clinical significance of this cavernous sinus?
In case of cavernous sinus, if there is infection at the dangerous area of face and that are drained by ophthalmic and facial vein, and these vein are valveless, and as cavernous sinus receive blood from them, so this infection may goes to cavernous sinus and producing cavernous sinus thrombosis.
Okay. So what are the signs of cavernous sinus thrombosis?
Cavernous sinus thrombosis sign is a painful swelling of eye and third, fourth, and sixth cranial nerve palsy, and also there is temporal loss of vision, gradual loss of vision.
Okay. So, and also there will be Horner syndrome, right? Horner syndrome.
Okay, ma'am.
Okay.
Yes, and sympathetic plexus also.
Plexus
Yeah,
also
revision.
get compressed. Now tell me
Yes.
the boundaries of the anterior fossa.
And anterior cranial fossa.
Yes.
Anterior cranial fossa is bounded in front, the frontal bone,
Okay.
and behind by the tuberculum sella and petrous part of the temporal bone superior border.
Petrous part of the temporal bone for
No,
anterior.
madam. Laser wing of sphenoid
Yes.
bone. Actually, I wanted to say the
Okay,
laser
no
wing.
problem. So now tell me the boundary of the medial cranial fossa.
And middle cranial fossa, then anteromedially by this limbus of the sphenoid bone, and anterolaterally laser wing of the sphenoid bone, and then posteriorly medially by the dorsum sella and petrous part of the temporal bone.
Okay.
And floor is formed by this petrous part and also squamous part of the temporal bone.
Okay, so can you tell me the content of this middle cranial fossa?
It contain the middle cranial fossa.
Yes.
It contain
Which
pituitary
part of
gland
the- Yes,
and in the center, and on both sides temporal lobe of brain.
Excellent. Now tell me the boundary of the posterior cranial fossa.
Posterior cranial fossa bounded anteromedially by dorsum sella and laterally petrous part of temporal bone, and behind there is the occipital bone in its squamous part, and floor is formed by the condylar, basilar, and squamous part of occipital bone, and also mastoid part of temporal bone.
Yeah, excellent, doctor. I want to ask you some more questions from here about the contents of this foramen. Okay. So can you tell me what are the structures are passing through this number 13 foramen?
Foramen rotundum, it pass maxillary division of trigeminal nerve.
Excellent. Now tell me what are the structures passing through this number 12?
Foramen oval, it transmit otic ganglion and mandibular division of trigeminal nerve, accessory meningeal artery, and laser petrosal nerve and emissary vein.
Excellent. Now tell me about number 14. What are the
Number
structures?
foramen spinosum, it transmit meningeal branch of middle meningeal artery.
Okay. Middle
And,
meningeal artery and meningeal branch of mandible.
middle meningeal branch of mandibular nerve and also middle meningeal artery.
Okay, so can you tell me if the middle meningeal artery got ruptured, what will happen?
There occur extradural hematoma.
Excellent, excellent. So this is all. Thank you so much.
Thank you, madam.
Excellent performance as usual, Dr. Umeatia. Okay, you have given a previous mock with us, right? Excellent. One previous mock. So here,
This is my first mock, actually.
first
Here.
mock here, I think you gave a previous mock here.
No, actually, this is my first mock.
Oh, okay. Then maybe I missed someone with you. Okay, so here's the some contents about the cavernous sinus. Okay, so what are the structures that drains the blood into the cavernous sinus, or the cavernous sinus drains blood from which structures? Both are same question. So you can remember it by this mnemonic face.
Yes. Okay.
So A for facial vein, E for emissary vein from pterygoid venous plexus, S for superior ophthalmic vein, and S for sphenoparietal sinus. So these will be easier to remember. And
Okay, ma'am.
after that, it will drain blood into pi. Okay, so pi means petrosal sinus, superior and inferior petrosal sinus, and also the internal jugular vein, and also some intercavernous sinus.
Okay.
Thank
Okay,
you
ma'am.
very
Thank
much,
you.
doctor. Okay. So let's see who want to be the next. Doctor, please raise your hand who want to participate. I can see Dr. Sujana Afrin, Dr. Sabrin, Dr. Raja, Dr. Mashkura, Dr. Nargis.
I would like to participate.
Okay, Dr. Sujana Afrin, right?
Yes.
Okay. Excellent. So, can you see this image properly now?
Yes, I can see this image.
Okay. So, let's start. Okay. So, in this image A, what is number 6?
Number 6 is body of the corpus callosum.
Okay. What is number 8?
Okay. Number 8 here is cerebellar tonsil.
Cerebral tonsil. Okay. Now, what is number 9?
Number 9 is cerebellum.
Okay. What is number 13?
Number 13 here will be cisterna magna.
Excellent. Cisterna magna. Then what is number 15?
Number 15 is fourth ventricle.
Fourth ventricle. Excellent. What is number 18?
Number 18 is genu of the corpus callosum.
Okay.
No, sorry, splenium. Splenium. It will be
Yes. Splenium, the thickest part of the corpus callosum.
okay. Thickest part.
So now tell me what is number 19, this structure?
This is going to be a third ventricle thalamus.
This is basically the thalamus.
Thalamus.
Which is the lateral wall of the third ventricle. Okay, so now tell me what is this red marked area?
Okay, this is a red mark area will be a suprasellar cistern,
Yes, so what is number 17 then?
pituitary gland.
Excellent. So above the pituitary gland, there will be suprasellar cistern. Now, what is this yellow marking area? This area?
This is yellow marking area is going to be prepontine cistern.
Yes. So this is the pons and this is the prepontine cistern. And what is this green area? Green arrow?
This is going to be the interpeduncular cistern.
Excellent. So in this image C, what you can see here?
Okay, I can see a sagittal section of the brain, MRI sagittal section, and there is a hyperdense lesion.
So can you tell me the probable diagnosis of this lesion?
It can be ependymoma.
Okay. This is basically meningioma.
Meningioma, sorry.
Okay. So can you tell me where does it arise from, this meningioma?
This arises from the arachnoid capsules of
Excellent.
the arachnoid villi.
Okay. So what structures may it compress?
It may compress the above superior sagittal sinus, and also it can compress the cerebral hemisphere and motor area.
Okay. So what structures does it lie between? In between which structures?
Okay, it lies between the fox cerebri and the cerebral hemisphere.
Yes. Okay. So can you tell me the clinical feature of this patient?
Yeah, this patient can have like nausea, vomiting, papilloedema, and also the patient can have all the signs, symptoms of intracranial pressure, like Cushing triad, for example, raised systemic blood pressure, irregular breathing,
Okay.
and
Okay.
vomiting.
Okay. So can you tell me an important presentation of this patient? Most important presentation.
Okay, patient will be have monoparesis of the
Yes.
contralateral limb.
Okay. So this is a must symptoms you have to tell. Okay.
Okay,
Okay. So what area of the brain will be affected then?
so it will affect the motor area 4.
So area located in the precentral gyrus. What are the areas?
Primary motor area is located in the precentral area.
Okay. So can you tell me the function of primary motor area?
Primary motor area function is to initiate motor movements of the body.
Okay. Can you tell me in more details?
Sorry, I would like to pass.
Okay, no problem. So now tell me what are the area of body is represented by the medial side of motor area? The medial most part.
Mm, I would like to pass.
Okay. So which layer of the meninges is with meningioma attached to?
Um, Dura.
Excellent. So now tell me in this image what you can see, image B.
Oh, image B. Image B. I can see that there is a ring. Ring enhancement lesion can be seen.
Okay. So why is this ring enhancement occurred?
Because it is an abnormal radiological sign. So basically, this is an area like surrounded by bright rim from concentration of the enhancing contrast dye. This enhancement actually represent the breakdown of blood-brain barrier and
Yes.
development and inflammatory capsule.
Excellent. So can you tell me some differentials?
Yeah, it can be cerebral abscess, it can be metastasis, and also it can be glioblastoma.
Okay. So what is the aggressive form of glioma?
Glioblastoma multiforme.
Yes. So now tell me how the CSF produced and circulate.
Okay, CSF is produced from the choroid plexus in the lateral ventricle, from which it goes through the interventricular foramen of Monro to the third ventricle, and from third ventricle it will go to aqueduct of Sylvius uh, and to the fourth ventricle, and from there it will pass through the foramen medially. There will be foramen magendi, and laterally there are two apertures, foramen of Luschka to the subarachnoid space. And from the it will be absorbed in the arachnoid villi and drain into the superior sagittal sinus.
Okay. So can you tell me from superior sagittal sinus, where does the CSF go? Next pathway from the superior sagittal sinus.
So from superior sagittal sinus, it will go to the
Which sinus from superior sagittal sinus?
transverse sinus.
Okay, but before that, at first it will meet into the confluence of sinus.
Confluence of sinus and then transverse sinus.
And after that,
From transverse sigmoid sinus,
and ultimately,
internal jugular vein.
excellent, internal jugular vein. So let's see what you have missed, as you have all 1 minute left. Okay, so what area of the body is represented by the medial side of motor area? What is the first organ involved in case of stroke or any tumor?
Mm,
Lower limbs. Okay. So the most medial side represents the lower limb part. Okay. So this is basically the motor homunculus. Okay. You can search in Google and see the image. And the lateralmost part of this motor area will be the facial area. Okay. So, okay, the last question. What type of contrast is used in this image B?
Image gadolinium.
Excellent. So this is all. Thank you so much, doctor, for your excellent performance.
You're most welcome, ma'am.
Okay, so let's see what you have missed. The function of motor area. Okay. So this is the central part of the brain, central sulcus, and in front of this central sulcus, there will be the primary motor cortex area. And behind this, postcentral gyrus, which represents the primary sensory cortex, right? And the primary motor cortex, again, the total motor cortex is divided into three parts: primary motor cortex and also supplementary and premotor area. So these two are together called area 6, and this primary motor cortex is Broadband area 4. So let's see what's the function. So area 4, which is the primary motor cortex, it basically involves with execution of movement. And the area 6, this supplementary and premotor area, which are involved with planning of the action. So here the planning of the action will occur, and after that they will send the stimulus to the primary motor cortex where the execution of the action occurs. Okay. So the premotor cortex, this premotor cortex, the blue area, okay, it receives signal from the external cues, which means some external stimulus like auditory reflex or visual reflex. Okay, so from environment, the stimulus, which stimulus goes to the premotor area, this is called external cues. And the supplementary, this orange area, which receives signal from the internal cues, which is from memory. So after that, they do basically processing and planning of the actions. Then they send the stimuli to the primary motor cortex, and final execution of the action will occur. So this is in a short the main function of the motor cortex. Okay, is it clear now, doctor?
Yes, thank you so much, ma'am.
Okay, no problem. So let's see who want to be the next. Please raise your hand, doctor. So I can see Dr. Fayaz. Are you there?
Yes, I'm here.
Okay, so next is for you. Next station. So Dr. Fayaz, how are you?
Oh, alhamdulillah, I'm fine. Yeah,
Okay.
I have some network problem. That's why it's
Okay, but I
sometimes
can
it's
hear you
loading.
clearly. Can you hear me clearly? Is my sound clear?
Okay. Yes, yes, yes. Yes, my
Okay.
previous all the stations are your voice breaking intermittently.
Okay, so can you
Okay,
continue? Can you continue?
yes, 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 yes.
Oh.
I'll continue. Yes.
Okay. So yes, let's start. What you can see here, Dr. Fayaz?
That is a circle of Willis.
Circle of Willis. Okay. So what is number 2?
Number 2 is anterior cerebral artery.
What is number 4?
It is a communicating artery.
Excellent. What is number 9?
Number 9 is internal carotid artery.
Okay. And what is number 11?
Number 11 is middle cerebral artery.
Middle cerebral artery. Excellent. What is number 17 here?
17 is posterior cerebral artery.
Cerebral artery. What is number 18?
I think posterior communicating artery.
Posterior communicating artery. Excellent. So what is number 24?
24 is a superior cerebral artery.
Okay. So can you tell me a name of nerve which passes through this 24 and this structure in between superior cerebellar and posterior cerebral artery?
Oculomotor nerve.
Excellent. The oculomotor nerve. This oculomotor nerve is very important. Okay. So now tell me how the circle of Willis is formed. What are the main vessels involved?
Main vessels are internal carotid artery and both vertebral arteries form the basal artery forms the posterior cerebral artery. And the internal carotid artery will give rise to anterior cerebral and anterior cerebral. Anterior cerebral give rise to anterior communicating, and internal carotid artery itself is giving the posterior communicating artery. That is the circle.
Okay. So can you tell me the branches, name of some branches of internal carotid arteries?
Internal carotid artery, when it is comes off from the cavernous sinus, the first branch is ophthalmic artery. After that, it will give rise to anterior cerebral and posterior cerebral.
Okay. And also here you can see the posterior communicating artery, right?
Yes, posterior communicating.
Okay. So now tell me, what is number 7?
7 is basal artery.
Okay. So how this basilar artery is formed?
By the union of two vertebral arteries.
Two vertebral arteries. Excellent. So now tell me how the vertebral artery enters into the skull.
Hello?
Yes, I can hear you, doctor. Hello, Dr. Fayaz. Okay. Okay, Dr. Fayaz, can you hear me? I think he got disconnected. Okay, so who wants to continue? Who wants to continue? Dr. Jahida Akhtar?
Yes, ma'am.
Okay, so you can continue from here.
Okay, so the vertebral artery basically uh, ascends to the transverse foramen from cervical 6 up to the C1 cervical vertebra, and then
Okay.
it arches over the posterior. Okay. So
Okay,
I
no
think
problem. You can continue. Dr. Jahida Akhtar.
yes.
Okay, continue.
Okay, and then it arches
Hello?
over the posterior arch of the C1 vertebra and enters into the scalp to the foramina magnum, and then it ascends upward, and at the lower border of the pons, it unites to form the basilar artery.
Okay. So now tell me the course inside the skull, the vertebral artery.
So inside the scalp, it enters and it moves forward medially and comes in front of the medulla,
Yes.
and then it ascends in front of the medulla, and at the lower border of the pons, it will unite to form the basilar artery.
Okay, excellent. So now tell me, what are the parts of brain supplied by these vertebral and basilar arteries?
It supplies the medulla, cerebellum, it supplies pons, midbrain, thalamus, and the occipital cortex.
What are you doing?
So which vein drains the dangerous area of the face?
It's the inferior ophthalmic vein.
Excellent. Now tell me the course of internal carotid artery in the skull.
Internal carotid artery enters the scalp through the carotid canal in the petrous part of the temporal bone.
Okay, and after that?
After that, it gives its first branch, which is the ophthalmic artery, and then it enters into the cavernous sinus.
Yes, and after that, it will give some
Gives
branches.
the branches
Anterior cerebral and middle cerebral.
and cerebral.
Okay, so now tell me, okay, you have already told the first branch of internal carotid artery. So can you see this image B?
Yes, ma'am.
Okay, so what is number 22?
It's the internal carotid artery.
Excellent. What is 31?
It's the ophthalmic artery.
Ophthalmic artery. What is number 1?
One middle cerebral.
Are you sure this is the middle cerebral?
It's an anterocerebral artery.
Yes, this is the anterocerebral. And what is 30?
Artery, ma'am, it's the lower division of the middle cerebral artery.
Yes, okay, we can also tell the middle cerebral artery as well.
Okay.
And this is the upper division and this is the lower division.
Okay, ma'am.
So what is number 15?
15 maybe lenticulosteroid artery.
Okay, not here, the lenticulosteroid artery. Which part of the brain is present here? Which lobe of the brain?
It's the occipital lobe.
Okay, are you sure this is the ophthalmic artery? You
I'm
have
so sorry, ma'am. This is the frontal lobe. Sorry.
frontal. So this will be the some vessels that will be give some supply, blood supply to the frontal bone, frontal lobe of the brain. So this will be the frontopolar artery.
Polar.
Okay.
Okay.
So this is the frontopolar artery. And what is number 34?
Ma'am, I'm not sure.
Okay, so here is a structure. A C-shaped structure is present here, and you can see the curve of these vessels also, right?
As a corpus callosum.
So what will be the 34? Pericallosal artery.
Pericallosal artery.
So this is easy, right?
Yes.
Okay, so this will be the pericallosal artery. Okay, and what is number 39?
39, it's
this 18 is here 39. The
it's a
branch of internal.
posterior communicating artery.
Yes. So all of these arteries are the basically branch of internal carotid artery.
Yes.
So ophthalmic artery, and this is the anterior cerebral, middle cerebral, and the posterior
communicating
artery. Okay, excellent. So in this image, what will be your diagnosis?
Ma'am, this on the right side there is a middle cerebral artery infarction.
Excellent. So what are the signs of middle cerebral artery infarct?
There would be hemiplasia of the lower half of the contralateral face and then hemiplasia of the contralateral upper and lower extremities of the body.
Okay. And in this image, what you can see here?
Ma'am, there is an aneurysm.
In which vessel?
Ma'am, on the right cerebral.
Right, middle cerebral. Okay.
Right middle cerebral.
Okay. So what will happen if it got ruptured?
It will result in the subarachnoid hemorrhage.
Yes, excellent. So basically, the circle of Willis is situated in the subarachnoid space. So any rupture from any aneurysm from the circle of Willis may result in subarachnoid hemorrhage. Okay, excellent. Excellent performance, doctor. Thank you very much.
Thank you, ma'am.
Okay, so Dr. Fayaz.
Hello, yes.
Yes, so do you want
Yes,
to
yes,
perform in next station?
Yes, it's okay. I'll perform it.
Okay, I'm sorry for this station. Okay, you got disconnected.
That's okay, fine.
Okay, no
I
problem.
got disconnected.
Just try to say a bit louder, okay, so that we can hear you
Okay.
clearly.
Okay.
Okay, so let's start. Okay, so in this image, what is number 17?
17 is olfactory bulb.
What is 18?
Olfactory tract.
Okay, what is number 21?
Optic nerve.
What is number 20?
Optic chiasma.
Chiasma. What is number 22?
Optic tract.
Okay, excellent. So now tell me, in this image, what is number 12?
Internal carotid artery.
Okay. And what is number 16? Which nerve it is?
1260. Oculomotor nerve. Third nerve. Oculomotor nerve.
So you can hear that, see the two vessels, right? What is number 1?
Number 1 is abducen nerve.
Abducens nerve, excellent. Then tell me, what is number 9 and 42?
9 is glossopharyngeal. 42 is facial nerve. Sorry, vestibulocochlear and facial.
So number 9. What is number 9?
Number 9 is facial nerve.
Facial.
42 is vestibulocochlear.
Excellent. So this number 6, 7, and 8, these three nerves arises from this pontomedullary junction. Remember
Pontomedullary
it,
junction.
okay? So what is number 37 then?
37 is trigeminal nerve.
Excellent. So in case of acoustic neuroma occur here. So this trigeminal, this facial, and vestibulocochlear nerve, these three nerves get compressed in case of acoustic neuroma. This
Yes.
is also called CP angle tumor.
Yes.
Okay, so now tell
Yes.
me, what next? What is number 38? This tiny nerve,
38. That is cochlear. What nerve? Cochlear nerve.
trochlear nerve. So after oculomotor, there will be trochlear nerve. Okay, so next is, I think that's all. Important structure. Okay, okay. So what is 33 here?
33 is glossopharyngeal nerve.
And also,
Hello?
yes, yes. With glossopharyngeal, what other nerves?
We'll have vagus and accessory nerve.
Accessory nerve. Okay, and what is 34?
34 is
So this is the cranial part of the accessory nerve,
34
and
is
this is the spinal part of the accessory nerve. 34.
that is the spinal part of the accessory nerve.
Yes.
Okay.
And the last is 32. What is 32 here?
32 is hypoglossal nerve.
Yes, 32 is the hypoglossal nerve. Excellent, Dr. Fayaz. Okay. And this is another image of this cranial nerve. Okay. So now tell me, what is the relationship between intracranial pressure, raised intracranial pressure, and oculomotor nerve?
When raised intracranial pressure occurs, initially there is an oculomotor nerve ischemia will occur, which will lead to oculomotor nerve paralysis. Initially, the first sign is to develop is mydriasis, followed by ptosis and ophthalmoplegia.
And what about the pupil?
Pupils will mydriasis, dilated, and
Dilated.
it will goes to laterally and downwards because of lateral rectus and the superior oblique.
Because of the unopposed action of the lateral rectus and superior oblique. Excellent. So what are the muscles supplied by this oculomotor nerve?
Superior oblique. Yes. Can you hear me? Can you hear me?
Yes, I can
You
hear
can
you,
hear me now?
doctor. Yes, what are the muscles
Okay.
supplied by oculomotor nerve?
Oculomotor nerve will supply all the extraocular muscles of the eye except lateral rectus and the superior oblique. This will supply medial rectus, inferior oblique, lateral rectus, and
Okay, so any eyelid muscle?
Hello?
Yes, any eyelid muscle?
Yes, levator palpebrae superioris
And
and sphincter papillae.
excellent, sphincter papillae muscle. Can you tell me the course of oculomotor nerve?
Oculomotor nerve starts from the oculomotor nucleus, which is situated in the midbrain. When it travels anteriorly in between posterior cerebral artery and superior cerebral artery. After that, enter inside the cavernous sinus.
And then?
From
Yes,
there,
yes.
it will enter into the superior orbital fissure.
Excellent, doctor.
Superior orbital fissure.
Okay. So what is the exact structure on which the oculomotor nerve may press against?
It was part of the temporal bone.
Excellent. So you have already told the features of paralysis of oculomotor nerve. So next question, what is this nerve? This red a marked nerve?
That is
This
oculomotor nerve.
And what is this nerve?
Red
This nerve, yes.
one is oculomotor.
Yes,
Oculomotor.
this red arrowed nerve
Red
is
one is oculomotor.
and yellow arrow indicating
Oculomotor. Yellow one is abducens.
abducens.
Abducen nerve.
Yes, so these two nerve basically involved with the movement of eye, and you can see here the both nerve enter into the superior orbital fissure, right here. Okay. So now tell me, what are the structures passing through this superior orbital fissure?
So, oculomotor nerve, cochlear nerve, abducen nerve, and ophthalmic nerve, and superior and inferior ophthalmic vein. Again, the ophthalmic nerve divided into three branches: frontal, mesociliary, and lacrimal.
Okay, excellent.
Hello?
Yes, yes. Thank you, doctor. These are all for your station.
Okay.
And you have completed
you.
within just 8 minutes. Excellent, Dr.
Okay,
Fayaz.
thank you.
Okay, so basically nowadays this oculomotor nerve frequently, is coming in exams. So you have to know about the oculomotor nerve in a uh, expanded way. Okay, the details of the oculomotor nerve, like what is its course, what are the structures it may pressed against, and also the clinical features of oculomotor nerve palsy, details about that. So I add here some, easy picture to remember. Okay. So about the course of oculomotor nerve, the nucleus of the oculomotor nerve is present in this midbrain. Okay. So the midbrain contains the nucleus for the oculomotor nerve. And after that, you can see here two structure, right? Two vessels. One is the posterior cerebral artery and superior cerebellar artery. So superior cerebellar artery is situated below the oculomotor nerve, and posterior cerebral artery is above the oculomotor nerve. So in between these two vessels, the oculomotor nerve goes forward, and after that, you can see here the cavernous sinus. So the lateral wall of the cavernous sinus. Then the oculomotor nerve passes the lateral wall of the cavernous sinus, and after that it enters into the eyeball through the superior orbital fissure. So mainly it crosses three structures. One is originated from midbrain, and after that these two vessels, and then cavernous sinus, and then superior orbital fissure. And after that it will give two branches, superior and inferior branches. Okay, so this is the course of oculomotor nerve. Always try to study with the anatomy with images. Okay, so this will be more easier for you. Okay, so here is the demonstration of the pathway from midbrain, lateral wall of the cavernous sinus, and after that superior and inferior division through the common tendinous ring of superior orbital fissure. It gives supplies to the superior rectus, levator palpebrae superioris, then inferior rectus, medial rectus, and also inferior oblique. Okay, and from this parasympathetic fiber, it also gives some parasympathetic fiber also, right? So these parasympathetic fibers goes into to the ciliary ganglion, and from that short ciliary nerve, and after that sphincter pupillae. So basically this oculomotor nerve causes the constriction of the pupil. So meiosis will occur normally, and also some supply to the ciliary muscle, which helps in accommodation. Okay, so if it got injured, or any palsy occurs in this oculomotor nerve, what will happen? So if the levator palpebrae superioris is got injured, then ptosis will occur. Partial ptosis will occur. And if the ciliary muscle is paralyzed, then loss of accommodation reflex. And also if the sphincter pupillae muscle is paralyzed, then mydriasis will be occurred. That means dilated pupil in case of oculomotor nerve palsy. And as maximum muscles, eye muscles are supplied by the oculomotor nerve except superior oblique and lateral rectus. So the action of the superior oblique and lateral rectus will be uh, taking the upper hand. So what will happen? Let's see. So as there is ptosis, you can see due to the lack of action of levator palpebrae superioris, and also the dilatation of the pupil due to sphincter pupillary function loss. And what is the function of superior oblique muscle? It basically downward movement of the eyeball. It causes the downward movement of the eyeball. So you can see the eyeball is rotated downward. And also lateral rectus, what is the function? Outward movement of the eyeball. So this is called down and out syndrome. So these will happen in case of oculomotor nerve palsy. So ptosis, deviation is the outward and downward due to the unopposed action of lateral rectus and superior oblique. Also the pupil will be fixed and dilated, and the loss of accommodation reflex. So this is all about the oculomotor nerve, the course as well as the muscles supplied by this, and the clinical features of oculomotor nerve palsy. Is that clear, everyone? Okay. So this is our last station for today's mock. Let's see who want to be the showstopper. Okay, so I can see here a doctor who is using Zoom user. So do you want to participate, doctor? Whose name I can see here, Zoom user. Hello, doctor. Can you hear me? Do you want to participate? Okay, no problem. So Dr. Umme Atia, Dr. Sujana Afrin, Dr. Faizan Jahida Akhtar, who want to perform the station, you can raise your hand, no problem. You can also take the station. Okay. So Dr. Umme Atia, do you want to perform?
Hello, ma'am.
Yes, do you want to perform this station?
Hello.
This is our last station.
Okay, I can try.
Okay, no problem. Okay, so let's start, everyone. This is important and new structures, okay?
Yes, ma'am.
So can you see this this image? The section of
Yes.
skull page? Okay. So now tell me what is number 5 here?
This is optic nerve.
Okay. Now tell me what is number 7?
This is internal carotid artery.
Yes, excellent. This is the internal
Hello,
carotid
ma'am.
artery.
I actually cannot hear you properly.
Okay. Okay. Let me adjust the headphone again. Okay. Now can you hear me?
Yes, ma'am.
Okay. So number 7 is the internal carotid artery. So what is number 15?
This is 18.
This structure.
I want to pass this.
Okay. So what is number 11?
This is oculomotor nerve.
Yes, this is the oculomotor nerve. So what are the nerves that arises from the midbrain? Can you tell me the name?
Madam, cranial nerve 3 and 4.
Yes, so this is the 3, and this will be the cranial nerve
4.
4. So what will
Trochlear
be
nerve.
the nerve? Trochlear nerve. So this is very thin and very very thin nerve, hair like structure. So this will be the trochlear nerve, number 15. Okay, so now tell me what is number 16?
This is trigeminal nerve, ma'am.
Yes, excellent. This is the trigeminal nerve. Do you remember in last image we can see here the trigeminal impression from the
Yes.
yes. So this is the trigeminal nerve. Okay, so what is number 19?
Number 19.
This one.
Okay. It may be it is a facial nerve.
Yes, and what is number 22?
Then it is a vestibulocochlear nerve.
Excellent. This is the vestibulocochlear nerve. What is number 22?
Ma'am, I have mentioned vestibulocochlear nerve.
Yeah, yes, 20. It's right.
Okay.
So what is 22?
22 is the 8th cranial nerve. And 19 is the facial nerve.
Yes, what is 22? This structure. Can you see it? Let me zoom it out. This 22.
Ma'am, 22 is the 8th nerve.
No, 20 is the 8th nerve. You have already told. As the facial and
20.
vestibulocochlear nerve. Yes, this is 19 and 20. Facial and vestibulocochlear nerve. What is 22?
Okay, 22. Sorry, ma'am, I want to pass this.
Okay, no problem. So this is the spinal root of accessory nerve. Okay, spinal root of accessory nerve. So can you tell me what is 26? What structure is situated in this gap?
Here, there is transverse sinus.
This gap. Transverse sinus is in this area. 25, 20.
This is for straight sinus.
This is for straight, as this is the straight area, right? So this is the straight
Yes.
sinus. So can you tell me in which structures this straight sinus is situated? In between which structures?
Which structure? In between
Here is a junction present. You can see here a cut part of something, the white glistening part. Okay, let me help you. Yes, Fox cerebri, excellent. And what is this structure?
This is tentorium cerebelli.
Excellent. So the straight sinus is situated between the junction of Fox
and tentorium cerebelli.
cerebelli. Excellent. Excellent, doctor. Can you tell me what is number 17?
And
this is a margin. Margin of what?
Margin.
What is this 27? You have already told. This is tentorium.
Tentorium cerebelli, but this margin, actually I couldn't get it.
Okay, no problem. So this is tentorium cerebelli, and this is the free margin of tentorium cerebelli. Okay. Okay. So in this image, what you can see here, this cut portion.
Here in the middle, madam.
This one. You can see a triangular cut portion of a structure. This number 12, structure 12.
Madam, your voice is so low. I cannot
Okay.
hear you.
Okay, sorry,
Now,
I'm sorry.
now.
Okay, now is it clear?
Yes.
Okay, so what is this cut marked area? This number 12.
Here, pituitary gland lies in this area.
No, pituitary gland is here, okay? But this is a cut portion of what structure? This 27, you have already told.
Oh, 27.
So here,
you have mentioned that it is tentorium cerebelli.
yes, so in this image B, okay, this 12 is the cut portion of tentorium cerebelli, okay?
Okay.
Okay. Can you tell me the attachment of tentorium cerebelli?
Tentorium cerebelli, in front it blend with the fox cerebri, and behind and no, in front it is attached to the petrous part of temporal bone,
Yes.
and behind it blend with the fox cerebri.
Any other attachment?
Ma'am, this I can remember now.
Okay, no problem. You can come back to it later. So now tell me, what is the blood supply of the inner table of the temporal bone?
Inner
Table of the temporal bone.
temporal bone. Okay.
Yes.
In the inner aspect.
Inner aspect, yes.
Ma'am, bone is supplied by the middle deep
Yes.
temporal artery.
No, not deep temporal artery. Remember, the blood supply of the meninges, okay, meninges, and also the inner table of the temporal bone, okay. This is supplied by the middle meningeal artery. This endosteal part, yes, middle meningeal artery. And the outer table and the skull received blood supply from the vessels that is supplied the skin of the skull. So basically, inner table of the temporal bone or any inner table of the any skull bone is related with the same blood supply of the meninges on that area. Okay. So in case of temporal bone, the inner table of the temporal bone is supplied by the middle meningeal artery. Okay. So if a tumor is in this precentral gyrus, what bone will it penetrate through?
Precentral gyrus, then parietal bone.
Yes, excellent, parietal bone. Okay, so now tell me, what is the aggressive form of glioma?
Glioblastoma multiforme.
Okay, and what is the major vein draining the brain parenchyma?
Draining the
brain parenchyma.
Brain parenchyma.
Yes.
Brain parenchyma drained by internal jugular vein.
No, what is the major vein draining the brain parenchyma?
Okay. Cerebral vein, ma'am.
Yes, definitely cerebral vein. A specific cerebral vein is the major vein of brain.
Okay. Middle cerebral vein.
No, it is the great cerebral vein. Okay.
Okay.
So basically, the major vein means the, you can remember by great vein. Okay. So the major vein draining the brain is the great vein, cerebral vein. Okay. So can you tell me about?
Ma'am, from great cerebral vein, it goes to cavernous sinus or?
Okay.
What?
Okay. So from the great cerebral vein, there will be draining into the, okay, let me check. Okay, sorry, I can't remember it now. I'll share with you in the group, okay? The whole pathway. Okay. So now tell me, what are the dural venous sinuses you know?
Dural venous sinus are paired and unpaired.
Okay.
And this includes suprasciatal sinus, infrasciatal sinus, straight sinus, transverse sinus, sphenoparietal sinus, and occipital sinus.
Okay. So now tell me how blood flows from the superior sagittal sinus into the internal jugular vein.
Okay, from suprasciatal sinus, it goes to the confluence of sinus,
Okay.
then transverse sinus, then sigmoid sinus, and then internal jugular vein.
Excellent. So now tell me what is false localizing sign?
Okay, false localizing sign means these are the neurological sign which reflect the dysfunction is in the distant area from the exact anatomical location. Like if there is raised intracranial pressure, and commonly nerve injury here, abruption or palsy, but its symptom will be remote from the primary lesion. Like there will be uh, paralysis of the lateral rectus muscle of the eye, and there is lateral gaze defect. This is known as false localizing sign.
Okay. So that's all. Thank you so much, doctor.
I'm sorry, actually, in the first image, I was so confused.
No problem. But if you have the clear idea about the, about the anatomical position of the cranial nerves. Okay. So if any image will come in exam, it will create no problem. So basically you have to carry an very clear idea about the location of all the cranial nerves, especially the cranial nerves related with the middle and posterior cranial fossa. These are very important in exam. And also here is the attachment of tentorium cerebelli. I know many of us get some difficulties with this attachment. So okay, let's study with image. Okay. So
Okay.
this white portion is the tentorium cerebelli. So you can hear some margins of this tentorium cerebelli. This is the anterior and medial margin, and this is the lateral margin, and this is the posterior margin. Okay. So
Okay.
what is this tentorium cerebelli basically? This is the projection of dura mater that covers and separates the cerebellum from the posterior cerebellum. So basically this acts like a diaphragm in between the cerebrum and cerebellum posterior. Okay, so laterally this is attached with the superior border of the petrous part of the temporal bone and anteriorly with the clinoid process. So this is the lateral attachment with the superior border of the petrous temporal part is laterally and anteriorly with the clinoid process. And posteriorly, it is attached with the occipital bone along with the groove for transverse sinus. Okay. And the anteromedial border, you can see here, it makes a, oval opening for the midbrain. Okay. So basically the anteromedial margin of the tentorium cerebelli is free. So this is the bony attachment in a nutshell about the tentorium cerebelli. And you have told nicely about the false localizing sign. These are the neurological signs that reflect dysfunction in a remote or distant site from the expected anatomical location. So most commonly occurs in abducent nerve pulse. This is all. Thank you so much everyone for participating. It was a nice session with you.